Okay, hi. Today I'm going to be demonstrating medication administration checkoff. So I've been given a scenario, my patient's orders, I have my MAR, and I have my box of meds to give to the patient. I've also got a med tray in case to set my meds up, and I've got the little basket if I need it, okay? So I'm gonna look at my scenario. Says to set up the 9 o'clock meds. Patient is complaining of chest tightness and shortness of breath. States he has been wheezing all night and no one will give him anything. His last dose of albuterol was yesterday at 19:10. Then it also has my vital signs. It has their temperature, their pulse, their respiration, their blood pressure, and if they have any labs. Make sure you check those if they're pertinent to any medicines you're giving. Make sure you take this to the bedside, so if you see in your drug book that you needed your apical pulse, you'll have it at your bedside, okay? So first I'm gonna do my first check. I'm gonna verify my meds against my medication administration record, against my physician's order. So that one's right, that one's right, that one's right, that one's right. I've checked all my meds. Make sure your scheduled meds are on one side of your MAR with the times. Your your PRNs are on the back with no times because you'll write in the time when you give those, okay? So make sure you check both, okay? If anything isn't inaccurate or you're missing anything or it doesn't match up, you would tell whoever's checking you off what the problem is. They'll tell you how to proceed. If you need to call the doctor, the person checking you off, the instructor checking you off is your doctor, okay? So I've done my first check. So now I'm gonna do my second check. I'm gonna pull my meds that are due at 9 o'clock. I have his first med, expiration date is good. His second med, okay, that one's good. Okay, that one's good. That one's good. That one's good, okay? So for these two, since I'm taking them out of their initial packaging, I'm gonna have to label my cup. So I'm gonna label my cup. I'm gonna put my patient's initials, the drug with the dosage, my name, title, date, and time, okay? And I'm gonna place that on my cup. You do the same thing for your syringes if you're giving an injection. Make sure when you're giving an injection that you place your label below the amount you're given so it can be seen. Okay, so I'm gonna take my lid, I'm gonna pour my pills into my lid so I don't contaminate it if I pour too many, and then I'm gonna pour it in my cup, okay? I would do the same thing for this second medication. Then I'm gonna put these back in the container. They don't need to go with me, okay? And he needs his inhaler. He can have it every 3 hours for shortness of breath, wheezing, or his O2 sats less than 88%. So I would put that on here to give them that as well. If you have a suppository, you wanna make sure you have Vaseline. If you're giving an injection, you wanna make sure you have an alcohol pad, okay? So that's all the medications I would have here for this patient. But I want to talk about your injectables for just a second. So you want to make sure you have the right syringe. Orange top for insulin. Make sure you verify your insulin while this is still in the bottle. You draw up your insulin, you scrub, let's start from the beginning. You scrub your hub or the top. You pull out the air. You inject the air. Make sure you inject your needle to your vial on the table. Then you can flip it over and you pull back however much you need. This is shooting because there's so much air in there. Ay, ay, ay. Okay. Sorry, there's so much air in this vial. Okay. Then you pull back what you need. Oh. And you say, can you please verify this insulin with me? Your instructor checking you off will verify your insulin with you. Don't take your needle out of the syringe until it's verified. Okay. They verify it, say you're good. Then you're going to scoop technique. Okay. Then you're going to label it. Sorry, I was on my hands. Same thing. What it is, their initials, your name, title, date, and time. Okay. Then you'll put that around your medicine, but you don't want to cover your stopper. So you're going to make sure that you put this below your stopper, and you can double it up like this. Okay. Then you put that on there. Make sure you have an alcohol wipe. Okay. Once you've set everything up, at this point, this is where you can look up all your medicines in your drug book, and you can tab them with a blank tab so that you're ready to go when you get to the bedside. You would say to your instructor or the person checking you off, I'm ready to go give your meds. We're likely watching you as you prepare your medicines to make sure they're correct. But if not, this would be the point where we could check them again if we were writing notes when you were preparing something. Okay, so orange top is for insulin. Gray top is for heparin. And the others are for the rest of the medicines. Okay, make sure if you attach your needle to draw up your medicine, you have to change it to give it. Okay, you don't give it if you attach it, you give it with a different needle. Okay. All needles go in the sharps container when you're done. Okay, so I've gotten everything, and my instructor says, okay, if you're ready, I've checked them off, let's go to the room. You're gonna look in this top corner for your patient's room number, and you're gonna have to find the room that they're in on the bedside, on the end of the bed. Okay, so let's go to the room.